what are the core parts of an eye exam? You've got checking your sight, checking what your prescription is in order to maintain good sight, their distanced kind of tests. We're looking at eye health in a variety of ways, the front of eye health, back of eye health, measuring pressure. You can do some rudimentary kind of tests on where do your eyes kind of rest in their position, but that really doesn't really tell you about how flexible your eyes are, how well they're working under endurance and changing sort of situations. Those kind of tests are sort of extensions. You have to go looking for those kind of tests.
If you've ever found yourself rubbing your eyes after a long day at the computer or wondering why reading feels harder than it should, it may not just be tiredness. It could be binocular vision dysfunction, where your eyes aren't focusing and teaming the way they should. Once again, I'm joined by Paul Graham from Harmony Vision Care on the Gold Coast. In Paul's clinic, he often sees both adults and children with these problems, known as accommodation convergence disorders, which can cause eye strain, blur, and difficulty concentrating on near tasks. Today, we'll unpack what that means, why it matters, and what you can do about it. If you or your child often experience eye fatigue, headaches, or trouble keeping focus up close, then keep watching because this conversation could make a real difference. But first, who am I? I'm Paul Salloway. I'm the owner of Optics Digital Marketing. We're an agency that helps independent eye care professionals to grow their clinics. So, hi, Paul. Good to see you again.
Likewise, Paul.
So to begin with, before we get into the details, so how common are focusing and teaming problems in your clinic, and do you find that most people don't realize that they even have one?
Yeah, look, it's a very common part of our practice. We get a lot of referrals in from patients referring other patients in because they notice similarities between what they've had. We get referrals in from other optometrists when they find and discover accommodation convergence problems, and so they refer those to us to sort of treat them. So it's become one of the strong pillars in our practice is to be working with those kind of conditions day in, day out. And look, they're relatively common, and it depends on how you measure it. And I'll often say that when we're measuring someone, we never measure a perfect visual system, so you can often find little kind of chinks in the armor in how well you focus and use your two eyes together. It's just a matter of whether those chinks are bad enough to actually start interfering with how well you do your work or your study, or even for some people it can impact on how well they navigate the world in terms of depth judgment and driving the car, parking a car, that sort of thing.
Well, I've heard the term accommodation convergence before, but I find that I struggle with a little bit because those terms don't seem actually descriptive of the condition. So I know that vision is a complex system, and there are a lot of different elements to it. So can you break down for us, like, what is accommodation convergence? What actually is it, and what's going on with our eyes that's impacting?
Yeah, well, so we've got two eyes, but we see one world. And so, part of the mechanism of seeing one world is making sure that both eyes are pointed to the same place in space. So if we move our eyes from distance to near, we have to move the eyes. We also have to adjust our focusing. So convergence is the act of moving your eyes inward. Divergence is the act of moving your eyes outward. And so convergence gets a lot of attention as one of those functions because we do a lot of converging, with near work and those sorts of things. And accommodation is that adjustment in the focusing. And the reason that the two names go together is that they're a part of the one process of being able to keep the world single and clear. And in modern life, that's particularly important for keeping the world single and clear when we're doing near work.
So when you say accommodation of focus, are you talking about like is it the crystalline lens?
Yeah, and I've got my model here. So
Yep.
favorite model. So we've got a lens that is flexible called the crystalline lens. So it's basically an elastic bag full of cells, and we have the ciliary muscle around it. And so we activate the ciliary muscle, which allows the crystalline lens to change shape. And so when we move our focus from distance to near, it's the lens that's actually sort of changing in the eye. So it's a way of adjusting the focus. And so that's where the sort of more scientific or medical term of accommodation comes from.
Mm. So I guess so in my own mind, I'm thinking that if you think of the eyes as like two different cameras, and so they've got to be pointed, in the right direction, but also the lenses themselves have to be focused properly. Is that
Exactly, and
fair
if
enough?
you use the camera example, I'm going to be careful around camera examples because it's fairly static, but that's probably an optometric problem rather than a problem for other people. But if we think of how a lens and a camera works,
Mm,
the old school ones where you adjusted the focus and the lens moved in and out, well, you've got lenses inside that don't change shape, so you change the distance between the lenses in order
mm,
to change the focus as you move closer and further from whatever you're trying to take a picture of. So what we have instead is a lens that changes its own power and its own
mm,
curvature inside the eye to do that adjustment. So, and it's
mm,
all about, if we have a look at the retina being effectively the film that you're trying to put focus the image on, then it's all about, as you move your attention to different distances, then we need to readjust
mm.
how that image lands on the back of the eye. And that's what that lens is all about.
Right. Okay. So there's at least two different systems here involved in getting good vision. Um, so
Correct.
why do these systems then sometimes fall out of balance?
Well, we're basically designed to be moving around in a three-dimensional world, and instead we sit still looking at two-dimensional things like you and I are doing right now. And so you've got this motor system that's designed where the eyes are constantly moving. The focusing system is constantly adjusting to keep the world single and clear as we move and look at different distances. And then so once you sort of make the focusing system have to sit still at a certain distance, it's going to
Mm,
fatigue.
mm,
And it's really just not designed to hold posture. And it's much like any part of the rest of your body. If you're holding posture for too long, you're
mm,
naturally going to get fatigue. And so what we see as a fallout is the direct effects of that fatigue
mm,
creating symptoms, but also you've got this sort of flexibility between your focusing and your convergence system to try and keep everything in balance. And so there's
mm,
a little bit of degrees of freedom where you can adjust one to keep the other working, and vice versa. But that has limits. And when you hit the limits of those adjustments, that's when you start to get symptoms of some sort.
mm. Okay. And is this something that would show up in a regular eye test, like your typical, annual check with the optometrist?
No, well, it depends what's tested. So it is the kind of thing that you do need to go looking for. So,
Mm,
if we have a look at, you know, what are the core parts of an eye exam? You've got checking your sight, checking what your prescription is in order to maintain good sight. They're distanced kind of tests.
mm,
We're looking at eye health in a variety of ways: the front of eye health, back of eye health, measuring pressure.
mm,
You can do some rudimentary kind of tests on where do your eyes kind of rest in their position, but that really doesn't really tell you about how flexible your eyes are, how well they're
mm.
working under endurance and changing sort of situations. Those kind of tests are sort of extensions. You have to go looking for those kind of tests.
Okay. So so let's say I might be able to still see clearly, but I might have a binocular vision dysfunction happening in the background. Is that right? And why would that matter?
Yeah, and that probably adds on to what we're saying in terms of having to go look for the problems,
Yeah.
and so you have to be asking the right questions as a clinician as well, because you know the kind of symptoms that have, for want of a bit, have been a bit doctified. So when you look at a list of symptoms for accommodation convergence problems, they talk about double vision because we've got two eyes. Oh, well, if two eyes aren't working together well, therefore we must get double vision. Now, honestly, double vision occurs, but it's not that frequent
Mm,
compared to all the other symptoms. And so I talk to patients about, you basically have two groups of symptoms. You've got what we call eye-related symptoms. And that's where myself as an optometrist and someone who's not an optometrist can discuss the symptoms, and we both might conclude that kind of sounds like an eye problem. Okay. So we've got, blurriness, double vision, sore eyes, tired eyes, and possibly some people might equate some headaches with that.
yeah.
And so you can kind of go, okay, well, they're the eye related symptoms. But you've got the other ones that kind of people may not immediately put down to it being a vision problem, and I tend to call them performance problems. So I'm not concentrating well, losing attention, losing my place on the page, getting bored while I'm doing the clear work, general concentration issues, maybe some depth judgment issues. And so those are the things that people may not realize, that they've been avoiding certain tasks
Mm.
because there's an underlying vision problem that doesn't allow them to do it well. And they naturally kind of just drift away from doing them.
Mm. So is this a condition that like mostly affects people who are doing near work, like students, office workers, that type of role?
That's when it's going to pop up most obviously.
Yeah.
So as I said, as I've been saying, you can have some depth judgment issues if you've got a particular type of accommodation convergence problem.
Mm.
But more commonly, yeah, you're going to get into, they talk about something like digital eye strain. So it's just eye strain. We call it digital
Mm.
now because most people are on digital devices, and
Mm.
I will often joke that when I was at school, it was, if you weren't academic, you were outside. So there weren't that many people getting eye strain. Whereas now it doesn't matter what your sort of level of engagement, involvement in school. If you use a device for long enough, you're at risk of developing some sort of eye strain symptom.
Okay. Well, let's talk a little bit more about eye teaming or focusing. So I guess there are different ways that this problem can manifest itself. So, like you've talked about convergence insufficiency. Um, can it also be a problem the other way, where the eyes turn too much?
Yeah, and depending on how you measure it,
Hmm.
people might have a little bit of both. When they're doing things, at one moment they're turning their eyes too much. At other times, the brain's going, "I've had enough," and that lets go of convergence. So it's really about that imbalance between focusing and eye teaming. So between the accommodation convergence system are out of balance, and what you're seeing is the person trying to cope. So if I push harder, I might turn the eyes in a bit more. It becomes a convergence excess. If my eyes are kind of giving up and letting go, it might look more like an insufficiency.
Mm.
The critical part is you've got symptoms and things are out of balance, and that's what we need to deal with.
Mm. And how about the other aspect, the focusing? So is it like, are there some situations where people's focusing system might be too weak or too slow to react, or perhaps even, just gives up, like you
Yeah, look,
mentioned?
and I think there's lots of different labels and names out there. I think
Mm.
there's possibly two categories
Mm.
where you have, and they're relative, but you have a convergence insufficiency often goes hand in hand with an accommodation excess. So what that means is
Hmm.
I'm focusing too much compared to how much I'm converging. So convergence is insufficient compared to accommodation. So I'm focusing here, but I'm
Mm.
converging out there. And
Mm.
then the other one is a convergence excess and accommodation insufficiency, where I'm tending to converge too close, but focusing is not keeping up. And so it's that stepping back and seeing that these things often will paired problems rather than occurring in isolation. And if someone's got a very fatigued system, sometimes it can
Mm.
kind of look like both because both systems have just fatigued and let go.
Right.
And so that's part of our job to kind of sift our way through and work out what's been happening there.
And what kind of environmental factors can aggravate this condition? Are we talking about things like lighting, just stress in general? Like what other factors could aggravate things?
Yeah, and if we take a leaf from ergonomics in general, so if you're in good health, good nutrition, working under good lighting, that all helps because our visual system, you know, we obviously need light. The better the quality of the light, the better the contrast, the less the brain has to work to figure out what it's looking at. So that is a level of fatigue and attention in the background, because vision and attention are kind of so tied together that anything that takes up your attention is potentially going to impact on how well you use your vision and vice versa. Okay, so and if we talk about general stress feeding into all these little stressful things, I've got deadlines, I'm tired, my eyes aren't working well, and they're all chewing up concentration. So you've got all of those sorts of things, and there's an interesting thing to look at where you kind of go, okay, well, kids playing on the iPad for 4 hours straight and not bothered by it, but can't read for 15 minutes without being tired. Well, they're both near tasks, and it's very easy to say, oh, well,
mm,
they're just the same thing. They're not. They're a
mm,
different level of engagement as a start.
mm,
They're a different activity. iPads and things and computers tend to be a bit more passive. You are self-directed. You kind of you know, you're doing your own thing on it. But if you have to do required reading for studying, that's a much bigger
mm,
cognitive load.
mm,
And if you're still learning how to decode and decipher what these squiggles on the page mean, that's an entirely different task to looking at a cartoon or a picture or playing a game on an iPad. And so
yeah.
the type of task that you're doing can make an impact. And I like to use the analogy that, if you've got a certain level of energy available and you go out to dinner with your best mates, you don't realize how late it gets sometimes. Yet you
Mm.
go to another function that's not your cup of tea and you're yawning and bored, many hours before that, yet you
Yep.
walked in with the same level of energy. Well, your appraisal and whether you enjoy the task and whether you're getting something out of it makes a difference. And which is where some kids might read for hours
Mm,
and put up with sore eyes or not even get sore eyes, and others might
mm,
get sore eyes straight away because they just get a different
yeah.
it's they get a different thing out of that
Yeah.
process.
Yeah, I think we forget sometimes that like we're not born to read. It's not something that the skill that you have from the moment that you come into the world. It's something that, it's a kind of an unnatural behavior in a way that we've learned to get information by looking at squiggles on a page. So that is something that requires, an additional load of concentration on the human brain.
Yeah, and it's a pretty recent thing in human history overall. So it's only really in terms of mainstream in the last couple of 100 years,
Mm,
and probably
mm.
even less when we think about it.
Yeah, that's right. Yeah, because like education wasn't that widespread beforehand. Well, if you're watching this so far and you're getting value from this discussion, so please do us a big favor and hit the like button. It only takes a second, and it really gives us help with the YouTube algorithm and increases the chances that someone else might benefit from this video as well. All right, Paul. Well, so how can somebody tell if they have binocular vision dysfunction and not just ordinary eye fatigue, say from a long day at the office or a long day at school?
Well, I mean, sometimes they can be part of the same story, really. We do sometimes call it the hidden vision problem. So some of the kids we
Mm,
might see, they're just not working up to they're bright child, but just not working up to expectations.
mm,
And they're trying to work out what's sort of going on. And like we've been saying, you might have perfect sight for
mm,
seeing the screen or the board or birds in a tree,
mm,
but that doesn't actually predict how well you're going to sort of maintain your place and maintain focus and convergence when you're doing something a bit more cognitive in the classroom. And the modern classrooms are sort of highly visually demanding.
yeah.
Um, uh, but sometimes it can be, we have to ask the question, um, you know, eye fatigue just normal, and therefore we don't need to put up with it. And there's lots you can do to try and help people not get the eye fatigue, so that they're
Mm,
doing their work in a better way. So a lot of the symptoms of eye fatigue are the very same symptoms they're looking for in convergence and accommodation convergence problems. So if you're getting a reasonable level of fatigue from your computer work and your desk work, then you really probably should be getting your eyes checked to see if
mm,
there's something that can be done about it. And certainly, if we're talking, you get it after 15 minutes or half an hour, well, you're definitely in the zone that you've got a problem. If it's after 3 or 4 hours, then okay, well, maybe we can get into that's just a lot of time on the computer. And the first thing to do is start taking some breaks. Every 60 minutes, take a 10-minute
mm,
break, get up, walk around, don't look at a device. If you can get outside, great. You know, and that all. And but if the problem persists as soon as you get back into doing work after that 10-minute break, then maybe you've got a problem.
mm. Okay. Well, I'll ask this question very carefully. So, there's been a lot of attention in the media recently about ADHD and dyslexia, and my understanding is that accommodation and convergence issues often have a lot of ADHD-like symptoms. So, what's sort of like the research on that?
Yeah, look, there was a body of research done around convergence insufficiency, and they did look at ADHD-like symptoms. And if you look at a symptom checklist for convergence insufficiency and some of the previous symptom checklists for ADHD, there were a lot of commonalities, because if we talk about those performance symptoms, avoiding close work, not being able to concentrate, and not being able to attend well, those sorts of things, you need to rule out a vision problem as part of the diagnosis for ADHD. So part of the workup is which part of those symptoms might be a vision problem, and which part of those symptoms might be more related to the actual condition itself. On top of that, there is some evidence that if you take a group of kids who have been diagnosed with ADHD, there's a higher prevalence of things like convergence insufficiency in that population. So yet another reason to help these kids, so they're not dealing with two problems, because we can treat convergence insufficiency. So if we can treat that, that's one less problem that they need to deal with. And if you treat a child and their ADHD-like symptoms disappear, well, it wasn't ADHD to begin with. Now, I'm not getting into, suggesting that a lot of kids are being misdiagnosed, or I've heard people say that, and I don't think that's fair. But we do have a responsibility to make sure that the kid's not dealing with two problems at the same time. And the same thing when we talk about dyslexia. I mean, the whole debate around vision versus other things as a cause of dyslexia, we're not getting into that. It's around, if I have a human being who's not performing well at school and I discover a vision problem, it shouldn't matter whether they have dyslexia or whether they're a normal reader. That vision problem may well get in the way of their best performance, whatever that may be, and they deserve the right to have that vision problem managed, because if we look at dyslexia, it's often considered to be a lifelong problem. The vision problem doesn't need to be a lifelong problem. And there's been dribs and drabs of statistics that indicate that kids who have reading problems and kids who have dyslexia have a high proportion of these accommodation convergence problems. Now, that's not getting into any suggestion that one causes the other, but, and we can speculate on why that might happen. But part of the thing I look at is that, well, if you're a struggling reader, you're doing more work to get on top of reading, to catch up, all of those sorts of things, compared to the child where reading comes a bit more naturally and easily to you. Again, that's more opportunity for an undiagnosed or a hidden vision problem to impact on you even further. So let's deal with the vision problem, because that's not lifelong. We can get rid of that and we can manage that. And that way you can concentrate your efforts on your reading.
Well, you mentioned treatment, and that's a really good segue in my last question here, which is, so can the eyes be retrained to work properly? So can you talk about like some of the vision therapy that can be done?
Yeah, and look, there are things like we call them eye exercises, but we're not exercising the eyes. I mean, the eye muscles are sophisticated, and they're much stronger than they need to be for the weight of the eyeball or the weight of the lens that they're trying to shift. And it's all about it being a fine motor control. And when we talk about fine motor control, it's teaching this to control these things, much like doing fine motor control to learn something new. You're not necessarily building stronger finger muscles. You're learning to send the right signals to them. And so when we're doing vision therapy or eye exercises, we're setting up a situation where the person can explore how to use the two eyes together more efficiently, so that the brain learns to use these organs and point them in the right direction. I mean, eyes are just bits of brain that we point at things, and we need to learn how to point them at things more accurately and more efficiently and more automatically, so that we're not burning up cognitive energy and concentration on what should be a sort of a basic skill. And so part of the role when we do vision therapy, and this is the why we believe clinic-based or office-based therapy is the most effective way of doing it, is that you can set up lots of different ways to manipulate the balance between convergence and focusing, so that you get a really strong generalized skill. And so we might use things like a lens, and you have to find ways of discovering through practice how to make that lens clearer. You might move the lens further away and it gets blurry, and you've got to work out how to readjust it. We might even use that lens and say, can you purposely make it go blurry? Okay, so that you're really learning to send the right signal, so that you as a person can choose how clear or how blurry that image is. We might use a way of selecting the input from one eye to the other so that we can create this kind of 3D effect. And then we might manipulate where those images sit, and you've got to readjust your focusing and eye teaming to keep that image single and clear. And so we're able to sort of step out into almost like step into, I should say, into an artificial environment to really stretch the boundaries of that flexibility between the convergence system and the focusing system. And so we have lots of different tools. I mean, a classic one is people have seen the Brock string. That is a tool. A tool by itself, I think it has some limitations, but it's certainly something that we use as part of just one activity in an overall sort of program to help people sort of discover how to use their focusing eye teaming better.
Sorry, I'm not familiar with that tool that you just mentioned. Can you
Binocular string. So it's a string, and we put beads on it, and you put it on your nose, and it's a way of judging how accurately your eye is landing. So you look at the bead, and then you get feedback on how accurate it is where your eyes are landing. But we can also use it as a feedback tool. Slowly you can move your eyes in and out. So a lot of our instruments are about giving you, the patient, the right kind of feedback, with having a therapist guide you so that you know when you're doing it right and when you're not doing it right. And that's the critical part, of a good therapy program, is that feedback. It's a bit like doing personal coaching at the gym. You're going to learn to use the equipment better in the right way and not the wrong way when you've got a personal trainer or a personal coach. And they're also adjusting your program based on the individual goals. And that's what we're doing in the therapy room as well.
Right. So you think that office-based therapy is going to be more effective than, let's say, computer-based therapy, because there are some like apps and things I think you can download, aren't there?
Yeah, look, and look, there might be one or two conditions if you're, for example, there's some stuff coming into the amblyopia space where
Yeah.
you might be looking at one particular thing that you're trying to change. And so a simple activity to change one thing, maybe that might work, but accommodation convergence is quite a complex system. And so just doing some computerized therapy, the problem with that is that you might get good at the game and then you can't actually transfer it into real life. That's why we need to use different bits of equipment and create these different environments so that you're able to generalize those skills and take them away so that they're working more automatically. One of the risks we see with computer therapy is that if you're doing it by yourself, you might overtrain an aspect. You might find a particular thing, like if you are someone who converges too much, you might jump onto a convergence program and go, wow, this is easy. And because it's easy, you keep doing that part and you avoid training the parts that you're not so good at. And so you can actually create some problems by overtraining the wrong thing.
So, all right. Well, and how long would it typically take for someone to see the difference if they were having a series of office therapy sessions with you guys?
Look, how long's a piece of string? Look, it really does depend on what sort of condition we're looking at. But if we're looking at it that sort of a regular accommodation conversions problem, then we're sort of looking around that 16, 20 sessions to get you a point where you're automatic, that we don't need to do any more therapy. You're probably seeing improvements anywhere between the 6 to 12 week mark, and it's all a bit different depending on how you've presented, because there's a little head of steam. You don't know how to do it. We've got to build some capacity and learning how to do it. What we've learned is that if you stop too soon, you haven't made those new skills. You don't own them. They're not a habit. You've got to turn them into a habit. So it's developing a new visual habit so that you're using your eyes without having to think about it in a much more efficient, better way. So we just need to do it long enough to have that happen. That's part of our review process, is how are you going? Are you getting the expected progress? And when can we see that you really own those skills and we can be hands off and you get on with life?
So it's really sort of like training the brain and your eyes to work together, and just making that sort of an ingrained habit with the way that you operate.
Absolutely. Is it? Yeah. And it's just getting the brain to find the quickest and easiest way to use the eyes without all the extra effort.
Yeah. Okay, well, fantastic insights as always, Paul. And before we wrap up, do you have any final words of advice for people who think they might have this issue.
Well, yeah, look, if you're getting eye strain symptoms, you're getting concentration symptoms, even if you see well, then, getting a thorough checkup that includes a good, thorough look at your convergence and binocular system, convergence and accommodation system is something we would recommend. And while we've talked about vision therapy, there are some simple things we people where it's just the right kind of prescription is all we need to do. So it's not one of these things where you're necessarily going to be having to go down the path of a big program. There are some relatively simple things we can do through prescribing that can help you. You need to at least rule out whether it's just a bit of advice on taking breaks versus no, you've got a problem that we need to deal with and that we can manage and make your life easier and better so that you're not having to sort of you know burn up a lot of attention and your energy on something that could be easily managed.
Okay. Well, once again, if you found this video helpful, please hit the like button so others can discover it on YouTube. And don't forget to subscribe to the Harmony Vision YouTube channel for more conversations with Paul about important eye care issues. So Paul, how can people get in touch with you there at Harmony Vision Care?
So we've got harmonyvisioncare.com.au. So we've got the phone number there, which is 0755205900. We've got a wealth of information on that website. You can also book you can book your appointments through a function on the website. We've got Facebook, Instagram as well, where you can find out more and see what we're doing.
All right then. Okay, well, thanks for watching, everyone. Take care of your eyes, and until next time, bye for now.
Thank you.